fetal abnormalities and ultrasound. There are more than 4,000 different forms of fetal anomalies which might affect one organ or multiple organs. These fetal anomalies and disabilities are potentially preventable through public education and awareness. So, public awareness and education about the factors, the predisposing factors, and causes of different syndromes like the marriages in the families, in close relatives, in cousins, which is called cousin marriages, is important, especially in the families having any chromosomal defects in their offsprings. They are supposed to be educated so that they don't marry with their cousins. There are multiple things which we have to keep in mind. So, the most important thing is public education and awareness. Definition. The term congenital fetal anomalies are structural, functional, and or biochemical molecular defects present at birth, whether detected at that time or not. So, are structural, functional, and or biochemical molecular defects present at birth, whether detected at that time or not. Detected in prenatal life or detected at birth or even if detected later on. We classify these abnormalities into three main categories: the lethal type, severe, and mild. The defects such as anencephaly or hypoplastic cleft heart syndrome cause stillbirth or infant death or pregnancies are terminated after the prenatal diagnosis of fetal defects in more than 50% of cases. So the defects like anencephaly or hypoplastic left heart syndrome, they can result in stillbirth or infant death, or even the pregnancies can be terminated in most of the cases. Severe defects such as cleft lip or congenital pyloric stenosis without medical intervention cause handicap or death. So medical intervention can decrease the severity or can control it or can treat it. Then are the mild abnormalities, the defects such as congenital dislocation of the hip or undescended testes, which are mild. So with passage of time or with the minor surgery, the testes can be brought to the scrotum, and even the dislocation of hip can be treated. Medical intervention, but life expectancy is good in mild type of fetal abnormalities. The nature and degree of these fetal anomalies that occur during the pregnancy largely determined by the stage of embryonic or fetal exposure to the causes of fetal anomalies. There are some fetal anomalies having major morphological defects, and as we know, the embryological life is from first to 8th week of gestation. So major morphological anomalies occur during this life. Most of the experts, they believe that the most dangerous, the most sensitive, and most important period of pregnancy is from first week to 8th week of gestation.